online several months ago, and I came across another gadget for the same purpose, to bring up mucus. It was a reed that vibrated
Yeah.
at 16 hertz.
Yeah.
You've heard of this.
Well, there are several different approaches to this. The vest is probably the most expensive and one of the more effective ways of doing this, but there are also devices you can breathe through. And there are a couple that are available by prescription. One is called an acapella, and another one is a flutter valve. And they have gadgets in there that cause vibration. So as you breathe out through them, there's a valve that opens and shuts, so it sets up vibrations in the air column that goes down into your lungs. Depending on the geometry of the inside of your airways, the frequency may have different to get the most vibration for the most people. So if you're using a reed that vibrates at a certain frequency, I think it would be hit or miss whether it's the right frequency for you. You might have, say, a series of reeds that have different frequencies, and you try all different ones until you get the one that's like, oh, I can really feel that vibrate. And then that's the one to keep and the one to use every day. But the ones that are prescribed, they're the main devices that are used by prescription are the flutter valve and the acapella. They do the same thing. You exhale through them and they vibrate. And you try to change something about it. On the acapella, there's a ring you turn. On the flutter valve, there's looks like a little clay pipe with a big ball bearing in it. And just by changing the tilt of it, you can change how fast it vibrates as you exhale through there. And then you feel how much it's shaking your insides. And the more it shakes, the better.
Never a day goes by, so I don't, sometimes it's white, pale yellow. When it's bright yellow, when it's really deep yellow, I know I'm in trouble. When people say COPD and bronchitis, I thought COPD was with bronchitis, that's kind of stuff.
COPD includes chronic bronchitis, emphysema, and even asthma.
That's what I thought.
Yeah. Chronic bronchitis means you have persistent cough and mucus for at least 3 months for 2 years in a row.
Never a day goes by, I don't have lots of phlegm come up.
Yeah. And if you have a problem, the problem with your lungs, one of the problems is too much phlegm production, then you try to do whatever you can to reduce the production of phlegm. But when you get to the point where you're going to be producing some anyway, then you should do whatever you can to help get the mucus out of there as quick as you can so that it doesn't come up worse, get you so clogged that it leads to pneumonia or just difficult breathing or wheezing.
I got lots of reasons.
Yeah. So before you can get into a routine of finding out what works to bring up the mucus and keep it clear, the better off it would be to try to keep it from coming up. Because a lot of the problems with bronchiectasis and also with COPD is from an infection, bacterial infection. Most people who are healthy do not have bacteria down in the lower airways. If you have chronic bronchitis, you do have bacteria in the lower airways. So you're constantly trying to sweep them up and out before they get a chance to set up an infection that would lead to pneumonia. So you have to keep that flow going. You keep them up and out of the way. When they start to get the upper hand, you feel like you're getting behind the process, and then you need an antibiotic to try to kill some of them so that you can kind of catch up and sweep them out of the way. But keeping the mucus flowing is really crucial. You can have the worst kind of bacteria down in your lungs, but if you constantly are getting them out of there and spitting them out, then before they can do you any harm, you can deal with it that way, and you don't always have to take antibiotics for it.
So far, I drink it up a lot of it, but I still
Yep.
have it.
And aerosol treatment is another good way to deal with mucus. We're using a nebulizer to breathe in either just saline or saline with a bronchodilator like albuterol plus ipratropium. Because the aerosol gets down deep and opens up the airways, and frequently people will cough up a lot of junk after.
I do that
They
3
have
or
to
4
use
times a
nebulizer
day.
treatment.
That does
Mucinex. There are several different types of Mucinex. There's like Mucinex DM,
Yeah.
and which is the most effective?
Well, there's a Mucinex and then there's a double-strength Mucinex. The more guaifenesin you take, the more likely it is to work. However, it also tends to make people a little nauseated. So that if that's a problem, the Mucinex is an extended release so that you don't take too much all at once and really make you sick to your stomach. That's the way they get away with charging what they charge for it. Guaifenesin is really pretty inexpensive, but by making it an extended release formulation, they can charge more for
So
it.
the DM is the.
DM means there's another ingredient in there, dextromethorphan, which is a cough suppressant. So if you're coughing a whole lot, and a lot of it is dry cough, then the dextromethorphan will help you just cough less. And the Mucinex part of it will help liquefy the mucus so that you can come up more easily and not have to cough so much. But if all you're trying to do is liquefy the mucus and get it up out of there, then you don't need the DM. Okay, haven't said too much about medications. We'll just take a few minutes to go through the differences. With asthma and COPD, a lot of the same medicines are used. Bronchodilators, albuterol, which usually works almost immediately when you take it by aerosol, and or by a dose inhaler. And it lasts for 2 to 4 hours, sometimes 5 or 6. The worse you get, the shorter it tends to last. Then there are longer acting bronchodilators. There are 2 that last for about 12 hours, Foradil and Cerevan. They're available by pocket inhaler, by discus for the Cerevan. There's a device that goes with Foradil where you put a capsule down into it, puncture the capsule, and then inhale the dry powder. There's a new one that's just come out, just FDA approved and not yet available. I don't know why the company is taking so long. It's called Arcapta, which is a once-a-day bronchodilator. So it's very similar to.
Can you say that word into the microphone, please?
Yeah, the brand name is Arcapta. Arcapta. ARCAPTA.
Is that the one that was sort of like just approved in foreign countries last year?
Yeah, it's already in use in some foreign countries. And it is FDA approved, but the company has not yet made it available in the U.S. And it's also a dry powder inhaler that comes with its own special device that you put the capsule into. So it's somewhat, on the average, is more effective than the 12 hours, and it only needs to be taken once a day. It's not going to be a miracle drug, but it will be somewhat better for some people. Check it out. The generic name is called Indicaterol. It's in the same family as all the other quick-acting bronchodilators, but it works faster than the last 24 hours. So that'll be more convenient for some people when we get it available. All of them would be effective for COPD or for asthma. Now, for COPD, there's another drug called ipratropium, which is frequently used because it works as a bronchodilator, not as well as albuterol for most people, but often in combination with albuterol. The nice thing about it is it has almost no side effects. So it works in a different way, and it adds to what you get from albuterol. You do together in inhaler, it's Pulmonologist, and in the nebulizer, it's called Duonet. Okay, so you get 2 different drugs in the same way. Usually used for COPD, not so much for asthma, although people with very difficult to treat asthma who are always looking for what else can I add in here that might do me some good, it's reasonable to try that as well. Spiriva is a once-a-day inhaled dry powder, which is primarily for COPD. Not usually add too much to asthma, but some people with asthma might find it useful. So if you're still suffering with asthma and you're taking all the usual ones, it's worth a try. But it's a real standby for people with COPD.
Aren't they, don't have, improving on, if they have a medicine that is supposed to improve?
Supposed to improve Spiriva?
Yeah.
Well, there are some other competitors for Spiriva coming out. Spiriva is the only once-a-day anticholinergic bronchodilator. There are some similar drugs that we'll have to wait and see whether they're better or as good as Spiriva. It's the only one that's available so far in the U.S. Symbicort is a combination of steroid plus Foradil. So it's a steroid plus a long-acting bronchodilator. Like Advair is a steroid plus a long-acting bronchodilator. Symbicort is also Dulera. So all 3 of those are different brands of the same concept, which is inhaled steroid plus long-acting bronchodilator. very good combination for asthma. For COPD, some people are helped by inhaled steroids, some people aren't. So what it does for COPD is to decrease acute exacerbations. So it's good for people who have frequent flare-ups, cases of bronchitis where they get all congested and more out of breath and wheezy, and sometimes after taking an antibiotic. So it's good to decrease the number of those episodes. But there are many people who try the inhaled steroid and it doesn't seem to do anything with COPD. It's almost always helpful in asthma. It is the mainstay here for people in asthma. Okay, Daliresp is another new drug that just been available since the fall. And the generic name for that is Pulmonologist. It's a whole new class of drugs that is not a bronchodilator. It is intended to decrease frequent exacerbations for people who are having flare-ups of bronchitis and COPD often. The studies for Daliresp show that it's better than placebo. So it is an effective drug. And there are good reasons to think, based on what the drug does, that it ought to be helpful. There are no studies of adding Daliresp to all the drugs that somebody who needs Daliresp is already using to know how much it really adds. So if you're somebody with COPD and you're already using something like Advair plus Spiriva plus albuterol or Convivent, does adding Daliresp really make an impact? If you're already taking all the rest of that, they haven't done the study, so we don't know. It's definitely an effective drug. Whether those other drugs also decrease exacerbations, and we don't know how much it adds. If you're taking all the rest of those things, you're still having frequent flare-ups, it's definitely worth trying to see what you can get from that drug, but we don't know yet.
I think Advair also, take a bunch of them from the Advair too, but prednisone, I have to have prednisone.
Yeah. Prednisone is reliable relief for shortness of breath for asthma or for COPD. What you try to do with achieve with prednisone is to take a big enough dose so that it does what it's supposed to do when you really need it. And then when you're not in so much distress anymore, you gradually reduce the dose down to the smallest amount that you can get by with. And you hope that that will be enough in between exacerbations so that you only need it when you're really bad and you can stop it when you're not so bad. Some people cannot achieve that. Some people, you can decrease the dose only to a certain point, and then you try to go lower and you feel like you're getting out of control again. And if that's what you do, you just try to, if that's where you find yourself, you just try to take the smallest dose you can and still be able to get adequate control.
Well, it also helps my arthritis,
Oh, yeah.
as well as that. But
Yeah, it's a strong anti-inflammatory drug, and the only reason that we don't want to give it is that the bigger the dose and the longer you take it, the more likely you are to get side effects.